Hey there, this is Justine Calderwood, physical therapist here at the Healing Spot, and I want to talk about my tools and some kind of magical, mystical things that have happened this week with three of my patients that I just want to share because it's fun. It's every day is fun when I get to work and work with the people that I do. So, what are my biggest tools? Right here, these hands, okay? I want to tell you some stories about some of the things that I feel with my hands that I can't always explain. I can, but I'm not going to do it in this video. And the other tool that I use a lot is this little small inflatable ball. And I give every one of my patients one of these when they come in and teach them how to use it. So I want to talk a little bit about a patient actually I just saw that gave me permission to share her story. Obviously, I'm not going to tell you her name or a lot of details, but basically she told me a couple weeks ago she slipped on the ice and she fell on her knee. And she goes, it's a little it was a little bruised, but she goes, I'm not really feeling it anywhere else. But she said, you might notice other things because of that. I just thought I would tell you. And so I assessed her body and saw that in her pelvis, it was a little bit rotated, and the right side into her low back, the muscles were a little, tighter and they had more tone in them. So I could tell that even from looking at her. So I got her on the table and I was working, and I want to share some of the things that I felt as I was working with her. And she's a long-term patient of mine. She's been coming in for quite a while and now just kind of doing maintenance every 3 months or so. And as I started to work with her, she could feel places in her body that were starting to release. And in particular, I was working on releasing her sacrum and her lower back. I'd already released the right and left sides to get into the muscles into the back. And I was right at her sacrum doing a release, a myofascial release. And I felt this surge of just shift. I can't always explain what I feel underneath my hands, but as I felt that, she said, wow, I feel like I just grew about half of an inch. Things had compacted. And I could feel throughout our treatment, she was here for 90 minutes, that things were unraveling and shifting. And what I told her, one of the other things that I felt actually came down to her feet, and she was lying on her stomach, face down, and I was pulling just really gently down at her feet. So I had my hands right in front of her ankles, her lower legs, and I was pulling very gently, doing what we call a leg pull, to decompress the spine and get into the hips. And what I was feeling was beyond my hands. I could feel into her hips, and it felt like her whole body, she was lying flat, it felt like her whole body turned slightly to the left, and it stayed there for a little bit, and then it came back. And she didn't physically move on the table, but sometimes I feel what I call the energy body. I feel energetically this imprint of something that has happened. Sometimes people physically unwind, and I guide them through that, but this was more of an energetic imprint that just needed to unwind. And it was interesting because right before I felt that, she said, I feel that in the top of my right foot into my toe. And I said, okay, just like I always do, feel into it, breathe into it, see what's there. And then she did the shift. And while she was there, she said, starting to feel a little bit better. And then it came back, and I was holding, and all of this was pretty much done silently. And I could feel just her body come to kind of what we call a quiescence, a still point. And it just stopped. It was like, okay, I'm done. So I checked back in with her and I said, how you feeling in your foot? And she said, yeah, I don't feel anything anymore. So that was neat, just to unravel that. And I'm sure it had something to do with her fall. I don't know exactly, but I suspect that had to do with her fall, maybe how she twisted, how she landed, and the body had that in as an imprint. So what I told her is, what's really interesting is that if she hadn't come in for her regular treatments, she wouldn't have probably even noticed until later on down the line that this was an issue, because it's not going to register in her mind. She's like, all she can remember is that she had some bruising at her knee. And so by coming in, and we were able to shift things, and she definitely looked better on the table and off the table when she stood back up after her treatment. I could visibly see, and structurally feel that her body was moving better. She wasn't stuck in that sacrum like she had been. So I said, who knows what would have happened months down the line, years down the line, where your body would have taken this strain and done something with it and possibly caused you pain. So it's interesting when people come in and they start to work with me, especially with people with long-term pain, and they have theories on when it started or why it started. But their body, but it's a lot of times coming from the mind. I think this. Yeah, I can recall this. But what is the body actually saying that's holding on to these prior traumas, these prior injuries, stresses that the mind's not registering anymore? Because it's like it's not big enough to stick out in the mind, but the body's saying, that's what happened. That's what I do, is help people guide them back to those moments in time to help their body, coming from the wisdom of the body, help their body get like unravel it and let it go. It doesn't come from the mind. And that's what I wanted to say, the power of these hands and the training that I've done and the practice that I've done with people. It is amazing, some of the stories. I could go on with many stories.